The application involves a geopositioning so that we can monitor publicly available data on where high-risk zones are. It incorporates geofencing, where if a player goes into a high risk or out of an area of low risk, we can get a notification. So from that perspective, geopositioning is quite different than contact tracing and or position tracking. So from that perspective, we have the ability to provide anonymity on a higher level than with contact tracing, which is something that individuals are very concerned about, and rightfully so. We wanted to make sure that we took that into account. Then when you begin to look at medical test data as well as physiological data that can be ingested into the system and viewed from a holistic perspective, we might begin to see that players or an individual has gone from an area of low risk to an area of high risk, while simultaneously seeing a decrease in their oxygen saturation levels, which is indicative of a higher level of risk. If we identify players in a training facility that has a large number of people that are coming to it and going away from it, if we identify people that are at high risk, we can then isolate them and the other members of the organization that are lower risk away from each other, so that the players that are at high risk can get the treatment and the care that they need, or the individuals in another setting, and the individuals or players that are at lower risk can continue practicing, competing, training at the facility while mitigating the risk of spread. That, in a nutshell, is really how everything comes together to work to add multiple extra layers of safety to them returning back to competition. This really can be applied across leagues, local sports leagues, collegiate sports leagues, high school sports leagues, whether it's football or soccer, as we like to say here in America, American football, baseball, basketball, tennis. It really is applicable across the board